Good morning and welcome to the Quality Network for Mental Health Services webinar. My name is Fatima and I'm the Deputy Programme Manager on the network. And behind the scenes, we've got Rob Lowe, who's producing this session. Do bear with us if we do have any tech issues, but we'll get through it with Teams. We know that there is a growing evidence that COVID-19 is posing a higher risk to people from Black, Asian, minority ethnic backgrounds, including health and social care professionals and carers. So I'm absolutely delighted today to introduce to you all Freedom. Freedom is a nurse consultant from Navigo Health and Social Care, as well as member of the QNOAMHS advisory group. And Freedom will be presenting to us some of the measures that have been that are in place in her ward to support the physical, emotional well-being of the Black, Asian, minority ethnic staff. But before we start, I just want to go through a couple of housekeeping rules. So the webinar is a live event and you will be on mute unless you are a designated speaker. It will be recorded and uploaded to our Knowledge Hub as well as our website so that you can share it with your colleagues and continue to share this video to people who are working in the care sector who can use it for the training and just information. Please do use the chat function to ask any questions. And if there are, I guess, some of the popular questions that come across, rather than asking it again, you can just vote for it, and then we'll put that to Freedom to answer. If you can't access the chat box, please do email us at op@rcpsci.ac.uk. We'll do our very best to either get to your questions during the session, or we can pick those questions up after the session. So before we start the session, I just want to note that this is a free event and accessible to our non-members. You're not paying a penny to access this webinar. However, for those of you who haven't engaged with us previously, we are a membership network. The work with the older adult inpatient services provides so the work that we do provides older adult mental health services access to a range of our quality standards. And we do this by working in partnership with staff, service users and carers in a comprehensive process of both self and peer review for the purpose of quality improvement and accreditation. We also have access to a range of resources such as a best practice bank, and we put on regular knowledge sharing events to help our members to fully immerse themselves in driving improvement in the service, but equally to, I guess, have a voice in what the quality of care that's provided to older adults who are in mental health services. So before I pass you on again to Freedom, just to note that if you are interested in joining our network, please do contact us or visit our website to find a bit more information about how you can be part of our growing family. We've also just recently published our 5th edition of the standards. So it's a great time to join the network and great time to support one another as well during this COVID-19 pandemic. So without further ado, please let me introduce you to Freedom. Over to you, Freedom.
Freedom, do you mind just unmuting yourself?
Yeah. Okay. Good morning, everybody. I'm hoping you can see me and hear me loud and clear. My name is Freedom Nwokedi. I live in Greensby. I work for an organization called Navigo. Navigo Health and Social Care, Greensby. By role, I'm a senior operational manager for acute mental health services here. And also, I'm a nurse consultant managing a ward as a responsible clinician for a group of service users. It's really an honor and quite humble to be able to share my experiences with you this morning. There will be opportunity for me to answer questions at the end of the chat. So I'm going to today try to share experiences of what we have done to support the Black Asian minority ethnic group here, and we have quite a few number of us here working with this trust. We are about 27 of us, both male, female, young, and old. So on that note, I would just like to start by starting with what we did first. So when people were reading on televisions, radio, the number of the Black ethnic minority groups that were affected, obviously the figure kept going up. Some of them we know, some we didn't know, but there was a lot of anxiety among the staff group, and it was huge. Staff were worried about their own selves, they were worried about their own families. Some of them have got very young families. So the starting point was for us to try to allay their anxiety. Some of the worries were actually centered around the PPE, the level of PPE that was being used. So we met with them on one-to-one initially, offered them reassurance, showed them and went through the list of the PPE we had, looking at the guideline also, and reassured them there will be available PPE, especially when they were hearing it also that there was low-level PPE nationally. But we had good stock, so which was comforting for staff. The chief executive sent a letter to all the staff, all the managers, asking us to undertake risk assessment. So that risk assessment was done, and concerns were raised. We tried to deal with those initial concerns. A few things were then approved. One of them was to look at the mask for the BAME group. So we all agreed that we could use the FFP3 rather than just the flu-resistant ones if we are dealing with people with COVID, the service user with COVID. So which was fit tested, and that was to improve the safety of the Black and ethnic minority group also. So that was reassuring. We equally, started a comfort room where staff could relax within the shift with treats, a few things that they wanted were all put in there. We equally looked at reducing the footfall on the ward. So some of the teams had to move out to reduce people coming in on the ward, the visiting. Doing that means that we are trying to manage the rate of infection to service users. And we hope that that will equally reduce the infective rate for our own staff also. So that was done. So for us, all the Black Asian ethnic minority group were all placed on priority lists for testing. So general testing was done for everyone. Families were given opportunity for testing also, which was utilized, especially during the first 5 days of being symptomatic. Scrubs were changed, so we bought scrubs. Before the pandemic, we were not wearing uniforms. We just come on our daily clothes. So we're able to supply 2-3 sets of scrubs for staff. The organization then provided money monthly in their wages for them to actually wash and help with the bills because of the rate of washing of the scrubs. So while waiting for the research, there was a lot of evidence to link low vitamin D level to the effective level of the COVID. So again, the organization then approved for us to supply 800 international units of vitamin D to all staff, so all the Black Asian minority ethnic group. So that was done, and a home testing kit was equally approved to be supplied to staff so that staff can undertake the testing at home. Depending on the outcome of that blood test, they will be treated. So if people are quite deficient, we will increase the level of the dosage we are providing. So that's in place for them. Some of us are waiting for the home testing kits to arrive also. Then looking at while during the one-to-one, some raised concern about the skin. A lot of us, our skin were equally almost scaling, so we had to approve for E45 350 grams to be supplied. That will be supplied till further notice until the pandemic is over. The vitamin D initially was for 3 months, so we will continue to supply until 3 months, and the treatment will equally continue for about 3 months also. So those are the things we have done. Again, because of tiredness linking to low immunity, staff were given annual leave. Some of them were equally encouraged if they wanted time off, whether it's 1 day, whether it's 1 week, to be able to do that. And that was put in place for all the Black, Asian, minority ethnic group. So again, looking at psychological effect of this pandemic on staff mental health and well-being, we had to get the psychology department on site. So they were based here on a few days, which was well advertised, so that staff can have that opportunity to have a one-to-one time with the psychologist who was based here. That was well utilized also. And most importantly now, we have now introduced a tool called SAD. SAD is a tool which was initiated. It's called Safety Assessment and Decision Score Tool. It was initiated, it was named after one of the GP, Dr. Sad, who sadly passed away during this pandemic. So the tool, Rob will be able to share the tool with you at some point if anyone wants to look at the tool. So what I'm doing now is on another one-to-one round with staff using the tool. The tool will be able to look at age, look at comorbidity, and then have a score. That score will then lead us. So there's a green, amber, and red score. Those scores will lead us to determine where staff will be able to work. Unfortunately, it might mean that some are not able to work with people with COVID. It might mean that some are not able to work with face-to-face with any more service user, depending on the risk. So we took that from Birmingham. I think it's a surgeon in Birmingham had actually worked on it, and we were able to have access to that. So it looks at people's ages, because with ages, ethnicity, gender, obesity, medical condition, the level of vitamin D. And then once we conclude that, we're able then to make decision on where people can work and where they cannot work. So I've said to Rob, I will release a copy of that. If anyone wanted to use it, that would be good also. There is now a 6-weekly testing also in place. So we are now encouraging staff, even though we have all been tested, to now utilize that opportunity to get themselves, to get their family tested, which will remain ongoing. And hopefully that will help to keep us safe, help to keep the service also going, and help to save lives also. So this is what we have done so far. So there will be opportunity for people to ask me specific questions if you want to do that. Thank you for your time, and thank you for listening.
Brilliant. Thank you so much for that, Freedom. So are we ready to take questions? So the first question we have is, did staff ask for enhanced PPE?
Yes, some during the first one-to-one, some staff were quite anxious They were very angry. They thought that nationally, and I'm going to be honest with you, that the government level of PPE was driven by lack of PPE nationally. So I shared some of those things. We agreed with some of them, and then what we did was to get additional PPE for them. So that was why we talked about FFP3, and we talked about coverall, so that will be more protective. And then we talk about the face and every other thing they needed. So I just took the stock and shared it with the staff, and staff were quite happy and comfortable that we have gone above the national guideline to provide those extra PPE for them. Thank you.
Brilliant. So just a question. So I guess in terms of like supporting I guess family members who wanted to visit in this difficult time, how have you been communicating with families?
So obviously it wasn't, I mean, some family will visit every day, so it was a very difficult decision. But what we have done was to initiate the use of Zoom. So families were able to communicate with their loved ones every day, as many times as they wanted. And so we bought some tablets, we bought additional laptops, we bought more phone calls, more phone handsets, so that people, even if at any one time 3-4 people, obviously you know how our ward is, people can do that in the privacy of their room. More staff were brought in to be able to facilitate Zoom. So staff and I mean the service users and the family were able to communicate. Okay,
excellent. So I've just got a question regarding the tool. Can you just provide a bit more information about the tool that you were using?
Okay, so let me just go through the tool with you. So the tool is called Assessment and Decision Score Tool. So it's briefly, it talked about why it was initiated, how it was initiated, the authors, and just move it a bit. So I'm trying to put it on another laptop, sorry. So it talks about, it's a scorecard. So the name, the staff name, the ethnicity, the gender, obviously BMI, which we know the role of BMI in COVID. So obesity, pregnancy, medical conditions, vitamin D levels. Like if you have from 30 to 50 also, under 30, it will score and give a total score. So the score at the end, we have mild score, which is from 1 to 8, depending on the score. You have the moderate score of 9 to 12, and you have a high score of 13 or above. So those who will score that level, unfortunately, what it means that we have to think of new roles for them, and some of the roles were like maybe they have to do other work other than their normal regular clinical jobs. Those of them who probably by support workers, we look at getting them to reception to take phone calls and all that. So we for those who are high risk, telephone consultation, video consultation, just to do paperwork in a separate office, look at staff training, doing their own training, and work from home. Most of them will be encouraged to work from home. They don't need to come in, and facilities will be provided for them to work from home. If they didn't have Wi-Fi or internet will be paid for them to stay at home where possible. So, and if they need any equipment, the equipment will be supplied for them to work from home.
Okay, brilliant, thank you. So another question is, so I guess with the focus on, I guess, the BAME staff, how have, I guess, other staff reacted to, I guess the needs of the BAME staff? Has there been any, I guess how have you managed that support in support of the BAME staff, as well as, I guess, the general staff within the ward?
So obviously, we, as a senior operational manager, I have to make sure I equally think of the other staff. So one thing we did was to communicate very well But you know what? They were very supportive because obviously it was concerning looking at the high death rate among the BAME group. So some of the things that we provided for the Black Asian minority ethnic group, we did provide, like the comfort room. Other staff were allowed to use it also among our cohort. And then some of the hand creams which they wanted, we ordered the hand cream. The chocolate when provided, like some of the sweets and treats and shower gel. At a point I had to just bring more shower gel, more cream, basically for everybody. So not just because we felt it would be too obvious that we are now like dividing the team. So some of those things were equally provided for anyone to walk in and pick up if they wanted. Doesn't matter whether you are white or black or anything. So that's how we manage it. But there was no problem at all. People were very supportive and quite concerned. But like annual leave, it was open. So if anyone was tired, we were happy. We stopped admission at a point, but all those have come back to normal now. Okay.
Brilliant. So that is all the questions that were asked. Is there anything that you can, I guess, any top tips that you can provide for the network on how they can continue to, I guess, work with, I guess, the broad range of staff to, I guess, deal with the pandemic, as well as the BAME staff in supporting them to, I guess, progressing through the stages of the lockdown and so forth?
The other thing probably is this question and answer. I think you have a forum where people can at least throw the question, because most of the practical things we did here, but the most successful ones, the one-to-one, and the support that was available, staff now know that they have a very supportive organization that will go to any length to make sure we are all safe. So it would be nice if the forum just continue to leave that communication open so staff can reach out to you, and if they are uncomfortable with some of the decisions being made, to be able to reach out, or when they are not sure, throw questions open in the forum, then some of us can respond and share what we are doing, because we're here to learn, share knowledge, share experience, and then support each other, so that at the end of it all, hopefully we will all have learned a lot during the process, and we don't pray that to see this kind of pandemic anymore in our lifetime, because it has been difficult and staff were worried. Some were even making arrangements of their own funerals, you know, because nobody was sure. Some had to go and do their wills and all that, and they were struggling, you know, but the one-to-one really opened my eyes to what people were going through, you know. So they finish the shift, you think, oh, hi guys, bye. But when they get home, they were dealing with a lot of, they were struggling. Some of them were breadwinners who have their families way back in Africa or in Asia. And then having to face your own debt, you know, thinking literally you might go to shift, contact these things, you might never recover. So it was quite difficult, but that was one of the biggest things we did, having one-to-one, and that carries on. So we haven't actually stopped. So we are now doing the risk assessment again on one-to-one basis. So it will be important for staff to be able to communicate through your forum what we are doing individually. Like I have shared mine with you, and I'm happy to learn from others and implement in this area also. Yeah, so
I guess you'd encourage members to of our network to continue to share some of the challenges as well as some of the opportunities that they have developed as a result of having to deal with COVID-19.
That's right.
So I've got a question here, which is asking, I guess, so have staff taken up the offer of the one-to-one psychological support? So what's been, I guess, in terms of the support that's provided in terms of, I guess, the emotional well-being of staff? What are some of the resources that you've got in place for that?
What we have is for them to reach out to their manager, but the psychologist was only based here. I mean, a few days. She's finished now. She's gone back. Some did utilize the opportunity. Some said they were okay. They didn't. But what we didn't do was, if there was anything out of the ordinary, they will have contacted us. Again, all of them is like going there, talking about their own individual struggles. Some of them, unfortunately, I'm not going to be able to individually mention, but most important was fear of dying, fear of their loved ones, losing them, particularly with some of them from a very difficult background. So that was quite a big thing about how they can manage if anything happened to their parents at way back wherever they originated from. So that was quite big thing that was a common theme among the discussion. So hopefully we continue to reassure them, and thankfully on this region, like I said to you earlier, the rate dropped. The rate is quite low. We are lucky here, and we haven't really had any positive, any staff with positive COVID. And so we will continue to do the things. So some of the things we are doing are right. We'll continue to do that. We hope that we will remain safe and save NHS and save lives also.
So was the one of the questions out? So the support that was offered, was it tailored to, I guess, to the BAME staff in terms of the counselling support, or was it just a general support that they were accessing?
It was general. It was both for anyone to access, anyone who was struggling, because it wasn't only the BAME that we are struggling emotionally, so it was open to everybody.
Brilliant. So there's another comment here. Is there anything you can suggest as to how we can help the organisation and the management to understand the needs of BAME staff when those in senior position may not be BAME background?
I know that's probably difficult, but they look at the guideline. They should be able to, somebody needs to, whether they're not from BAME or not, they need to be able, somebody needs to just take that upon themselves to be talking to the organization. So what we do here, we have a COVID call. So BME is one of the agenda on the call, and anything we hear, I mean, some of us who are in senior position, I'm the only one on that position, but whatever I hear from national guideline or from colleagues that is happening elsewhere, I raise it. So we raise issues with the call. So it might be helpful, anyone who is interested, particularly the line managers, to be able to raise those issues of concern and to open that door of communication so that staff will be able to assess their managers, you know, either through supervision, through one-to-one, and raise their concern. And then the managers should be bold enough to be able to raise it to the trust board, you know.
Okay.
And hopefully they will listen. The main thing is hopefully they will listen.
So I guess it's about engaging in a wider context, conversation with, I guess, your line manager, and then having the conversation with the wider and the managers perhaps in the more senior roles.
That's right.
Okay, so there's another question here. It says, so did your trust provide the vitamin? So you talked a little bit about the vitamin D medication for the BAME staff. So that was provided by Navigo to the staff, or
yeah, I organize that, sign them, get every staff to sign the vitamin D and the E45. So.
And then this comment here says, we did more of a reflective group for all staff, and it's still ongoing, but do you think perhaps one-to-one would be more effective, I guess, rather than doing more of the reflective group setting, but perhaps a combination of both?
I would say one-to-one, because the one-to-one really opened our eyes. People were more comfortable to talk about. Some even broke down, some were crying. I remember, and I'm not going to mention them, I remember one of the one-to-one. This was somebody that very bubbly, you know, very fit, and you know, when you see happy staff, you know them. But during the one-to-one broke down because the mom was bedridden at home. Obviously, a lot of poverty were there, and then the worry was that if anything happened to her here, there won't be anybody there at home who is going to do the funeral and all that. So the one-to-one, I will always advocate for one-to-one, because then you get to know your staff, you get to understand their fears, the anxiety, the worries, and you can then tailor your support to individual rather than generalized support. In the reflective group, which I've done in the past, people will not open up. People are ashamed to talk about themselves. People, I noticed among our group, people want to say, oh yeah, I'm okay. But beneath that, I'm okay, there were a lot of struggles. And I mean a lot of struggles. But the one-to-one help us to deal with them. People's needs were different. Everyone's need was different. Some of them we had to support, some we had to support with financial. And a few things we had to do, which wouldn't have been done if it was like in a group.
Okay.
Thank you.
So I guess some of these questions are, I guess, regarding, so does Navigo have like a BAME network for people to engage in?
Well, we had previously, but it wasn't. I didn't push it. I think it just people didn't utilize it well before this time. And obviously my position, I don't want to see myself alone as just an advocate of BAME alone. But we are looking at it. I've already requested that we have started. One thing I forgot to mention, we now have a WhatsApp group.
Fantastic.
We have a WhatsApp group of BME, so we can then talk to ourselves. We are chatting, we are checking every evening how we are and sharing ideas and anything we want to talk about just as a group. Navigo has encouraged me to do that.
So we've got just a new question that's just coming in.
Okay.
Let me just get that, just bear with me. So how have you been able to offer that one-to-one meeting for staff who perhaps work at night? So I guess looking at your staff who probably, you know, don't work during the day, and what's support been like for the night staff?
Well, some of them I had to come in. I had to come in to manage their shift. So the next one we're drawing, which Joel is doing at the moment, we look at their shift and come in when they're on shift. So not necessarily for them to come in during the day off. So it's one-to-one will be done according to their shift. So if people are on night, that means their freedom has to be there during the night shift to see them. So instead people having to go up and down. Remember, we talked about rest break, we talked about annual leave. So it was unfair for me when I was doing the one-to-one to say, we did Zoom. Remember, I think I didn't mention, we did use Zoom one time. Some of them came, some didn't. So, but equally the one-to-one is done according to when their shifts, which is timetable and attached to the rota. So they know when people are coming.
Fantastic. So I think that is all the questions that we've got published. Thank you so much for that, Freedom. It's been really useful to actually hear about, I guess, your experience of, I guess, developing and supporting your staff. So yes, and of course, if you think of any further questions that you would like us to put forward to Freedom after this, please do email us, and we'll continue to have these conversations with our network. We also have the a shared learning forum that happens every other Thursday, so every 2 weeks. So the next one's next Thursday, and again that provides a platform for members to discuss some of these issues that they are facing, whether that's BAME staff or whether that's to do with I guess your, as a manager, your well-being of actually managing a team. And it's just a very informal space for you to share and to support, share and learn. So you provide a bit of support, and then you get some of that support as well. And that is every Thursday. So if you need a bit more information about that, please do email us, and we can get you involved in those discussions. So thank you so much for joining us, and we look forward to welcoming you to our next webinar. Take care and stay safe.
Yeah, thank you everybody. Thank you for listening. Thank you so much, and have a lovely weekend.